lung cancer that is very, very important to be known. And we see the most of the crowd that these days that have been coming in, we do have a lot of lung cancer patients that are coming up, and understanding the risk of the lung cancer. I'm sure you all would be eager to know about the risk factors, the preventions, the the aware about what all steps you can take to detect the lung cancer. So I'm very excited to take this forward, this session. So we have a very senior Dr. S. Suresh, who's our senior medical oncologist, who has 14 years experience in medical oncology. And the speciality of his is he's not only a medical oncologist, but he's also a radiation specialist as well. So we welcome you on board, Dr. Suresh. It's such an honor to have you. Very good evening. So Suresh sir, actually, when we see that there are more than 2 million people that have been detecting of lung cancer, and there are many people who would be eager to know as to what would be the causes of lung cancer, and how do we prevent that, and what are all the areas that they have to focus, and how do we take this forward?
Yeah, good evening, viewers. It's a warm welcome from VS Group of Hospitals. Today I'll be speaking and clearing your doubts on lung cancer. This being a November month, it's a lung cancer awareness month. And the ribbon for lung cancer awareness is white or pearl. So that's why our background is white or pearl. And today, as most of you will be asking why the cancer has come and why the lung cancer has come to me and what are the causes for this. We'll be speaking one after the other. As the session progresses, I'll be telling what are the reasons for that. One thing which we have to be very alarming is that lung cancer is going to be the largest percentage of cancers. It is the #1 cancer among all men and female included, even if its breast is in the female. But when it comes to both the sexes together, then lung cancer is the leading cause of cancer and the leading cause of death also in cancer. So,
Doctor, actually, the first question that comes in our mind is, what is lung cancer?
So, the breathing machine which we have in our body is the lungs. So, the breathing, inhale, exhale, and whatever we do is through the lungs. And this lungs, when it is irritated by some of the genetic particles or smoking or some other causes, which we will be discussing later, can make a change in the normal function of the cells. And this can lead to the lung cancer. So lung cancer can be in the lung parenchyma or the covering. It's also called a pleural malignancy. So we'll be speaking on lung cancer, the lung parenchyma more today.
Wow, that was very informative. So, doctor, actually, what are the causes that would develop the lung cancer?
Yes. So most of the people will be asking, sir, I don't have any side effects. I don't have any vices. I don't smoke. I don't drink. But why should I get a cancer? So lung cancer is one thing which is most commonly associated with smoking. And this was the first casual association of a particular irritant causing cancer. So this all started in around 1930s when a British doctor wanted to know about is there any relationship between a particular irritant and a cancer, and then he took a postcard. So that days there was no internet, and then he asked all his friends in medical schools to post their smoking habits and lung cancer, because most of his friends died of lung cancer. So TB was one of the most common disease that day, but lung cancer was also there. So most